Hi everybody, it's Dr. Amna Husein, board certified pediatrician and licensed lactation consultant, here to answer your questions that you sent in through Little Spoon. So this question is actually really interesting. First of all, congratulations on your newborn. But secondly, it's very common for children to experience regressions when they go through something new. A move, for example, or if they've started school, and in this case, if there's a new person in the house, a newborn who's taking mom and dad's attention and perhaps a little change in their routine. So first of all, I want you to know it's normal for a child to experience some sleep disruptions, but there is a difference between nightmares and something that we call night terrors. Sometimes they can be a little confusing, but I wanted to explain because this is really important. First of all, nightmares happen at a different time in their sleep. Usually they can happen in the early morning, and usually it's in REM sleep or rapid eye movement sleep. Usually these can be really frightening and the child does remember them. In this case, it seems like your child just can't communicate because they're a toddler at this point. But it's very common usually to see this. The most common things you can do to treat it is reassurance. We usually do not give medications. Very rarely do we give medications. We ask you to re-script the dream. So if there's a monster chasing them, then something funny or whimsical or lighthearted might happen at the end with the monster. You might want to desensitize them. So, let's get monster spray and it's water in a spray bottle and you spray around the room at nighttime to make sure you scare all the monsters away. And lastly, we can use something called cognitive behavioral therapy or CBT for very refractory, sort of intense nightmares for children. Now, the other instance that I was talking about, night terrors. So this is actually something different. It occurs a little earlier in the sleep and non-REM cycle. So children actually do not wake up at this point. So parents are terrified because they hear them screaming, but the child has no recollection of the dream. So this is very different from a nightmare. I hope that helps.